Welcome back. Well, bone health can be a key for a lot of women. It can easily feel like an issue, though, that you might feel like is out of your control, but there are steps you can take to help slow down the rate of bone loss as you get older. Here to explain it all, we're going to take charge of our own health this morning is Dr. Diana Bittner. Thank you so much for being here,
Good
Dr.
morning,
Bittner.
of course.
So I was mentioning to you before, when I moved to Michigan specifically, I talked with my PCP, and she said maybe take a vitamin D in the winter because I was feeling a little anxious, you know, in the winter months. Let's talk about vitamin D. Should women be taking this all year?
It doesn't hurt to take it all year. We don't have to take it in the summer if we're outside at some point, even wearing sunscreen. But it's super important, mainly for bone health, but also we think there's some data around reducing risk of heart disease and maybe even cancer. And for some people, it helps with that seasonal affective disorder or mood changes when it gets dark.
Well, I found it interesting that vitamin D really helps with our bone health. And of course, we can get it naturally outside. But let's talk about, you know, being safe when we're outside this summer.
Exactly. Well, first of all, what most people don't realize is that we start losing bone at 32. So we reach our peak bone mass at 32 and we start losing thereafter. So vitamin D is super important, especially if we live north of Atlanta.
Okay, which we do.
Super important. But yeah, so vitamin D is important for that.
And when we get outside and we get it naturally, just slap that sunscreen on. You're still going to get the vitamin, right?
Yeah, I've got many patients who ask me if I wear sunscreen, am I going to block that D and do I still need to take it? So the bottom line is sunscreen does not block vitamin D. We're still not going to block all those rays even with SPF over 30.
What about, too, I read workouts could help with bone health. Let's talk about that,
so again, you know, summer is such a good time for vitamin D, but also to be outside and getting those workouts with biking and hiking and, you know, even swimming in terms of building our muscle mass. And muscle mass is important because it pulls on our bone and tells our bone we need to, the cells need to build bone. So it's helping maintain and build bone.
Use it or lose it is what you said, and that's great.
Use it or lose it.
Yeah. Let's talk about Jane.
So Jane is 50, and she came to me, of course, for her annual, and she was in early menopause. And so we got a bone density to see where she was at as a baseline. And she was actually very upset that she had osteoporosis. And she's like, why did no one tell me? But bone loss is very silent and it can be sneaky, and menopause is a risk factor. So we looked at her risk factors, and she had not taken vitamin D in her 30s and 40s because we weren't talking about it. And so she was vitamin D deficient. She had a family history, and she was also very thin. So because of that, she had osteoporosis, and she was upset because she liked to mountain bike and ski, all these things that would put her at risk for a fracture.
Sure. So what's our tip of the week for ladies as they hear about Jane's story?
So know your risk for bone loss, and if you have any of these risk factors, ask your doctor for bone density. Menopause, again, is the biggest risk factor for that. And if you have bone loss, then make sure you know what to do about it. Take your D, calcium, be active, and potentially consider medication.
Thanks so much, Dr. Bittner. Get outside, take your vitamin D, and of course, get moving.
Get moving. Thanks.
Appreciate it. All right.